My stomach has been hurting all day. Before I touch the patient, what's the first thing I should do?
Today, we're making abdominal assessment stupid simple. There's one order you have to follow, and if you get it wrong, you can mess up your whole assessment. Inspect, auscultate, percuss, palpate. Every other body system, you listen last. The abdomen is different. You listen second. Why? Because percussion and palpation can physically stir up the bowel. That changes the bowel sounds. If you push on the belly first, then listen. You might hear sounds that aren't really there, or miss ones that are. Simple rule: listen before you touch. First step, inspect. Look at the shape, symmetry, skin, belly button. Any distension, scars, visible pulsations? You're just using your eyes. No hands yet. Step 2. Auscultate. Listen in all 4 quadrants. Start in the right lower quadrant because bowel sounds are usually easiest to hear there. Then move through the remaining quadrants until you've assessed all 4 areas. Listen for bowel sounds before you touch anything. Determine whether bowel sounds are present. Remember, touching the abdomen first can alter bowel sounds and affect your assessment findings. Step 3, percuss. Tap to identify air, fluid, or underlying structures. Tympany, hollow, is normal over most of the belly. That's air in the intestines. Step 4, palpate. This step is last for a reason. Start with light palpation first. You're checking for tenderness and guarding, then move to deep palpation. You're checking for masses and deeper areas of tenderness. Remember, light before deep. If you press too hard right away, you can cause unnecessary pain and miss important findings. That's why palpation is always last. Pop quiz. A nurse is preparing to assess a patient's abdomen. Which action should the nurse perform first? A. Palpate all 4 quadrants for tenderness. B. Percuss the abdomen to assess for air and fluid. C. Auscultate bowel sounds in all 4 quadrants. D. Inspect the abdomen for distension and symmetry. Pause the video if you need time to think. Correct answer is D. Inspect the abdomen for distension and symmetry. Why it's correct? The abdominal assessment sequence is inspect, auscultate, percuss, and palpate. Inspection always comes first because it's non-invasive and gives the nurse baseline information before touching the patient. Why the others are wrong? A. Palpate. Wrong. Palpation comes last. Touching the abdomen too early can alter bowel sounds and cause unnecessary discomfort. B. Percuss. Wrong. Percussion comes third. It involves touch, which should happen after listening. And C. Auscultate. Wrong. Auscultation is second, not first. You have to look before you listen. NCLEX tip. Abdominal assessment is one of the most commonly tested assessment sequences on NCLEX. Remember, inspect, auscultate, percuss, and palpate. If you palpate or percuss first, you risk stimulating bowel activity and getting inaccurate bowel sounds. Listening first protects the accuracy of your assessment. Safety consideration. If a patient has a pulsating mass or suspected abdominal aortic aneurysm, do not palpate deeply. This can be dangerous. Notify the provider instead of palpating further. Thanks for watching. If today's lesson helped make nursing a little more simple, hit that like button, subscribe, and turn on notifications so you never miss a new video. Want even more No BS nursing? Head over to Patreon for study guides, fill in the blank worksheets, cram sheets, NCLEX-style practice questions, case study scenarios, and exclusive content designed to help you think like a nurse. Thanks for being here, and I'll see you in the next lesson.